Hello, ladies. My name is Isabel Bart, and I'm coming to you with some education around early stage breast cancer. By no means this is medical information. I am not a doctor or healthcare worker, but I just went through early stage breast cancer at age 41, diagnosed in April 2020, and healed in August 2020. I'm here for the main reason that I want all of you, if you're going through the same journey as I am, to have that information from the standpoint of a patient, not from the standpoint of a doctor or a nurse or a healthcare worker. Not because they are not giving you information, of course, they are, the clinicians, but because I think the experience from a patient standpoint may be very, very different. And I'm going to be sharing candidly with you what that experience was for me. So I'll cover everything from the moment I got diagnosed and there was something suspicious to going through surgery or radiation in my case, and what the options that I had were, why I made some choices, and basically helping you feel comfortable with your journey. And I am so sorry if you're here because you just got diagnosed. um, I am sorry. However, I see my cancer as a blessing in the end. I am not going to see life in the same lens going forward, and I see that as a huge blessing. So I'm here to help you, and I'm also available. You can reach out to me anytime. I really want you to get the support you deserve. So again, a little bit about me. I'm 41 years old. I have two children, aged 10 and 12. I live a very healthy lifestyle. I'm an exercise enthusiast. I do a lot of outdoor activities. I do not drink much alcohol. I do not smoke. Again, very healthy lifestyle. And I work in business and marketing. Sometimes maybe that work brings me some pressure and stress, but I felt very strong. I was able to get a lot of work done and taking care of my family. And just when I got diagnosed, that was a total surprise. So again, the diagnosis may come in different ways. There are some women who actually find a lump themselves, or their doctor found a lump by touching. That was not my experience. I went for a routine mammogram because my breast is very dense, and that is actually fairly common for a lot of women, and that might be your case. My OB asked me to start doing mammograms at age 39. Good news is, no matter what, you're covered starting at age 40. So hopefully, if you don't have a lot of family history or condition that your doctor may point out that you need something before age 40, do not forget at age 40, go and start getting your annual mammograms. So I started my first mammogram, I was 39. I did my second one at 40. Never thought anything for a second. I just thought I was doing my due diligence, my healthcare routine. And these in 2020, interestingly, my mammogram was on March 17, and that was right when COVID broke out in the United States. And actually, I think they closed the mammogram center shortly after. My appointment was scheduled. I went. I was working from home at the time. I was one of the only patients there for safety reasons. And again, I didn't think much about it. I'm like, well, let's get it done. I'm doing a good job here. I'm taking care of myself. 2 days later, I get a call and they say, well, we found a little thing on the mammogram. The next step is to do an ultrasound. So I got an appointment. During the ultrasound, the technician took a lot of different pictures, and what was appearing like they were able to tell me right away, well, we can kind of see the size of something, and it doesn't seem very big. It doesn't seem like it's in many other places, so it's like something very isolated. Of course, when the radiologist came over, he said, well, what I see here tells me I need to do a biopsy. And oh my gosh, the word biopsy freaked me out. I'm like, really? I thought they were literally going to rule this out by, oh, this is just a benign mass, and we'll see you next year. So at that moment, I had a little bit of a panic attack, and he said, do not worry, that doesn't mean anything, but that's the protocol. All right. And also, it was a little bit disturbing in a way. He said, well, because of the way, you know, insurance typically works, you have to come back in 2 days. So we're not going to do the biopsy on the spot. I was like, okay. And again, you know, I think he confirmed for me that it doesn't look like any other areas, but that spot they were seeing was suspicious. So again, you know, I also talked to my generalist doctor in the meantime, who called me and said, very high chances that this is benign, you know, do not worry, you know, go do the biopsy and maybe this whole story will be behind you in a week. So 2 days later, I went in and they did a biopsy. It's not painful at all. They, you know, kind of put a needle in there and just get a little bit of tissue. So that process wasn't too hard for me. They give you a compression wrap around your chest to wear, and I literally wore it for 48 hours nonstop. You know, I didn't take a shower for 48 hours, and I was feeling fine. I didn't have any complications from it, and I don't think you know, complications are to be expected. It was a little bit nerve-wracking because of obviously knowing the possibility that this could turn into a cancer diagnosis. But I was still hopeful that until I knew more, there was no reason for me to stress out. So went home, and again with my compression garment, and I still was able, you know, to walk and things and do minimum physical activities. And about 2 days after the biopsy, I got a call from the doctor, and the radiologist shared with me that he had some good news and bad news. The bad news was that there were indeed cancerous cells in there. The good news was that that tumor was very small, very non-aggressive, and progressing very slowly. So back to, I want to talk a little bit about diagnosis here. Again, they will go over different components of your cancer. They will be able to tell you if the cancer, you know, what the tumor grade, which is a number between 3 and 9. Mine was 3, which, you know, the smaller the better, I believe. The size approximately, so mine was 1 centimeter, which is not even half an inch, so something's very small. They also will be able to say if it's hormone receptive or not. So this is a pretty big deal, and I don't want to make this very complicated, but what it is by the way, I think a majority, more than 50% of cases of breast cancer occur in the left breast. Nobody knows why. Mine was on the left, and the majority of them occur on the upper outer quadrant, which again was my case. So I was very textbook. My tumor was on the upper left-hand side. They also have a lot of different type of breast cancers. Mine was a dual carcinoma, which I think accounts for about 80%. Again, like I really picked the most common kind, and very textbook here. So they will tell you the kind. So back to the hormone conversation. So when your cancer is hormone receptive, they see that as a positive thing. Why? Because that means these cells have the ability to grow if they are fed by hormones, mostly progesterone and estrogen. And so what that means again is they do have ways to treat that through medication, and that's part of the protocol of treatment that I am still under, by being able to block and to feed the cells something else that will, you know, not make them grow. Again, if the cancer is not hormone receptive, that could complicate a little bit. Again, here we're talking about my personal experience, and it's stage 1 and very early. So the other piece is they will try to find out if your cancer has spread. And they look at lymph nodes. So on the ultrasound, for example, they were pretty positive that it did not get to the lymph nodes. Not if it did, doesn't necessarily mean that it's something extremely serious, but that is where they get a little bit more concerned that maybe it reached other parts of the body. In my case, right away, I was reassured that that would not happen, or at least it didn't appear to be anywhere near the lymph nodes. So I was reassuring myself that this was a limited area, a very non-aggressive cancer. And again, the very typical one that they know how to treat. So I felt confident going in that, well, first of all, it was definitely not life-threatening, even though it is cancer, and the word cancer, I think, scares a lot of us. So that is, I think, a little bit of the silver lining in this as well. Could be worse. So again, back to the diagnosis. So we know, tumor grade, the size, is it hormone receptive? Did look like it spread? My radiologist was very good, and after that, he wanted to prescribe an MRI just to check any other areas of the breast, both sides, left and right. And we did the following day. And the MRI turned out to show, of course, the tumor that we knew was there and had been biopsied, but also a very small spot on the other side and another small spot on the left side in the same area as I had my tumor. So what happens next after that MRI is I was brought back for another ultrasound. The radiologist looked at the pictures and figured out that the right side, that was a very benign thing that he was not worried about at all. Left side, well, that little thing, and it was about half the size of the first one. So small, 4 millimeter size, that would not have been detected on mammogram or ultrasound, by the human eye. So again, it was able, then knowing where that was from the MRI, to go look at the ultrasound, and had the same thought as my first tumor, which is, we need to biopsy this because it looks suspicious. And really, I thought, what? Another one? What's going on? So if you remember, I explained back 2 days later because of insurance. So I had a lot of trips in that office, and I have to say the staff was outstanding. Another biopsy, another cancer diagnosis, exactly the same type of cancer, same grade, hormone receptive, of course, the same thing. It was far enough remote from the first one, though, that they didn't think that they were like necessarily related or, the same area. So, well, at least what I really felt, even though a lot of relatives and friends around me were a little bit panicking, oh my gosh, you have cancer, I'm sorry. I thought to myself, you know what? Actually, I feel very good right now because the radiologist saw everything that could be seen in my breast with possible technology of today. And really, there's no way there was anything else. And it was small, stage 1, did not spread. So you know what? This was caught early. They did a great job to see it on the mammogram in the first place. And really, without that technology, I may have gone 5-10 years until this become big enough to be felt or to be, seen in the older days when mammogram technology wasn't what it is today. So even though I felt so young when I got diagnosed, I'm like, well, it kind of makes sense because at the rate it's growing, it probably wouldn't have become anything very serious maybe for 5 or 10 years. So trying to to be thinking that it was almost a good thing that wasn't very, very dangerous or anything. At the same time, related to diagnostic, I also want to point out the fact that there's a couple of things that they also may do after you get diagnosed, and I'm going to share for a second here. So we talked about stage of type of cancer. There, I believe, maybe over 12 or 15 types, and the hormone situation as well as genetics. So the reason why genetics is important, even though we think family history is very important in breast cancer, actually, I believe from the stats they show me, only 10 or 15% of cases are related to family history. So it's not a vast majority. But when you get diagnosed so young, like I did, I had the privilege of being tested genetically, and I actually asked to check not only for breast cancer genes, the BRAC gene that can be related to not only breast cancer, but also ovarian cancer. And also different cancers. So I was able to ask at the same time to be checked against other markers for other cancers. Well, the good news for me is that everything was negative. So no, no genes that could explain why maybe cancer happened at my age. So I don't know what my journey would have been like if the gene was positive, or if they said that I had that gene, because it's fairly typical that women might decide when they are carrier of the gene to go ahead and have preventive mastectomy, right? As you may have heard, to avoid, because the chances are fairly high that they'll develop that cancer in their lifetime, as well as ovarian cancer potentially. And the thing with ovarian cancer still today, it's not easy to diagnose. And a lot of time, by the time you get diagnosed, it's fairly advanced, not like breast potentially. So again, in talking about my own experience, which is the majority of cases, my genetic testing came back negative. So after getting all these elements, my radiologist directed me to the next person on that team, because that's amazing. Like, the medical team is really here to support you and surround you. So typically it's, the nurse navigator, the radiologist who you start with, and then there's the surgeon, and also the oncologist. And depending on what your treatment plan is, you may have, radiation MD. In my case, I went through radiation, so I had that. And they all talk to each other, they all know your case. And so my next step was to talk to the surgeon. Well, I did my research as well, like most of you will probably do. And I figured that likely this was so small, it was probably just going to be taken out, in a quick surgery, and we'll never talk about this again. Well, I was a little bit surprised that the surgeon was actually balancing the different viewpoints and really weighing in on my options between lumpectomy, which is removing just that area that's cancerous, and mastectomy, which is removal of the full breast. I wasn't sure that she would even go there, especially with my genetic testing that came back negative. But she expressed a few concerns or a few advantages potentially for mastectomy. One of them being that the risk of recurrence in mastectomy patients may be slightly lower. And that risk is usually estimated by decade. So if you're 40 years old and hopefully you still have 40 years to live, you kind of multiply that difference in risk by, by the amount of decades you still hope to live. So she wanted to be upfront with me and be clear that that was something I should take into account, that mastectomy could limit the risk of recurrence, if we're really looking at statistics. Also, if you do a mastectomy, you do not do radiation afterwards. Again, here in stage 1 cancer, which is the topic of our conversation here, there is no chemotherapy prescribed usually, so I was not a chemotherapy patient. But if I selected lumpectomy, I would do radiation therapy. If I did mastectomy, I would not have to do that. The other concern for the surgeon was that, because if you remember my diagnostic, I had 2 little tumors, not too close, but in the same area. So she expressed that she would need to take out these 2 areas during surgery. And each one she needs to take, no matter the size of the tumor, no matter how small it is, you still need to have probably at a minimum a golf ball size, because they want to clear the cells around it and check that there is no more cancerous cells around it. So she said that, taking these 2 things in my breast, and I do not have extremely big breast, might, end up creating potentially some cosmetic concern. She also was very good up front and recommended that I talk to plastic surgeons and radiation therapists, so that I will understand more about what it will entail to do radiation therapy versus plastic surgery reconstruction with a mastectomy. And I would totally recommend that for you. So meet with the radiation therapist and the plastic surgeon before making a decision. If, like me, you have really the option to go in between lumpectomy or mastectomy, because that will really help, help you make that decision. And again, I'm going to give you a snapshot of what, summary of what I just kind of went over. So you can choose to have lumpectomy, which is followed by radiation. Mastectomy, you don't have to do radiation, so it could be a plus. Lumpectomy, if the margin, as I explained, don't come out clear, and if they take out this, an amount, and there's still cancerous cells around, they may need to operate again. And in a case like mine, when the breast is not very big, at some point they may say, we need to remove everything because it's really going to look awkward, right, to take such a big part of your breast. Mastectomy, you can do reconstruction, right? So you put an implant and they can do a great job at that. In lumpectomy, which is my case, this is just an ambulatory procedure, so it doesn't last for too long. For a few hours, you're at the hospital. If you do mastectomy, you typically stay the night. It's more invasive, obviously. You have drains, so it's a different type of procedure and a longer recovery. Again, in lumpectomy, there is that idea that maybe the risk of happening again could be higher than mastectomy, even though it seems like that, data might be questioned sometimes by experts and doctors. Okay, so coming back to, again, that decision, and like I said, really, in my recommendation is meeting with the radiation therapist and the plastic surgeon. So one of the things that was actually that maybe the plastic surgeon and the surgeon didn't necessarily agree on is another concern from the surgeon was that if I did lumpectomy at this point in time, and a few years from now, I get cancer in the same breast, and I need to have surgery again, reconstruction at that point in time may be more complicated and even maybe impossible, which really made me ponder, because I thought, oh, what if I end up at maybe 45 or who knows, right, a few years later, and I have to have another surgery. And at that point, I cannot have an implant. And then I have literally like no breast on that side. That thought was very scary. Well, I met with a plastic surgeon, and he actually said, I will do it. It's more difficult for me, but we will be able to do reconstruction. At the moment that he said that, I knew that I was going to go for lumpectomy, because with my very active lifestyle and my age, I wasn't quite ready to get rid of my breast and have an implant. I just, I have considered it, and I thought about it, but I just thought, it's just so small, and maybe just kind of a funky thing, and it will go away, and I'll keep being healthy and you won't come back. So I knew, again, if he came back, we will do surgery again. I will get an implant. So that made me feel really good. Sometimes if the lumpectomy also removes quite a big lump, he said that if you have fat in your body, they could maybe take that fat and fill that area after lumpectomy. But in my case, it didn't seem really that possible. And they showed me the implants, and that was really cool to just go through the process. And I think it's part of your decision journey. So I would really strongly recommend you go through that process, because it is key to really kind of, for you to face reality of what you really need to decide, the kind of choices you need to make. I met with a radiation therapist as well. That visit was virtual, because during COVID times, actually, a lot of the doctors I met virtually. And the radiation therapist did a great job showing me data, showing me the treatment plan, potential side effects, but he answered all my questions. And I felt like, you know what, I'm probably going to do radiation anyway. So I wasn't too concerned about it. And the other thing that, I would recommend is talk to patients who've gone through it for, understanding their experience like mine. even though everybody has a different reaction to surgery, to radiation, it's very helpful. And also what was amazing to me is you start talking to people around you at work or with friends, and you say, oh, I just got diagnosed, and suddenly people will say, oh, my aunt got it, or my mom, or my grandma, or my sister, or and actually even at work I had a couple of colleagues call me and saying that they had it years ago and I had no idea. So it might be more common than we think. And I think, again, people are a great source of information. Also show you the variety of journeys that can be out there. But the more information you gather, I think, for yourself, the better choices you will make. So back to the decision. So the other piece I don't want to forget about as a young woman, if you're in your 30s, your 40s, is birth control. One thing that I think we don't necessarily think about when you think about breast cancer and treatment is if you have the hormone receptive cancer like I did, the common one, you do not want to have hormones feeding your body. And birth control brings hormones to your body artificially. Pregnancy will bring hormones naturally to your body. So what was a little bit, I think one of the worst parts of this whole experience for me was, hearing, well, we don't want you to get pregnant. I already have children and it's not in my plan, in my immediate future, to consider having more children. So I was fortunate. If you want to have children, whether you already have some or not, they will talk to you about basically, getting your eggs, freezing your eggs, and in the future, considering like IVF and so on, right, in vitro, because they are very concerned that if you were pregnant, the hormones could literally feed, whatever cancer cells may be around in your body. And again, not that I had that plan, but being told, do not get pregnant, or, you probably don't want to have any other children in the future when you're 40. Well, it's just a little bit, it's just something you have to process. But birth control was also a major concern because I had an IUD with progesterone, fairly common for women who've had children. And it was so perfect for me because after a year or so, you don't get periods anymore, at least in my case. So I went every month without bleeding very much, so not having to worry about that. And having to think about going back maybe to, my teen years or my 20s before I had children, and almost forgot what it was to have a cycle and a period. So I had to take care of that. I had to remove my IUD. I decided to put in another IUD without progesterone, without hormones, which is the copper IUD, which kind of works a little bit different than the progesterone one, but blocks pregnancies as well. I could have decided to use condoms or to, basically get my tubes tied, or if you have a single partner, a solid partner, they can also do a vasectomy, right? So you have different options, but pick the one that's best for you. So I resolved the contraception issue by having that new IUD put in, but I was not expecting, right, what it would be like to go back having cycles and, could affect my temperature more than usually, or bleeding every month for several days, and could be heavy bleeding. Took me a couple of months to get used to. So again, even though here we're talking about breast cancer, I want to make sure that the other impact on your body. And for me, contraception and periods was actually another hassle to deal with besides cancer, because for me, it had become a non-hassle with this progesterone IUD. So not something that the doctors may tell you right away, but something sincerely to consider. And again, here you have a lot of choices, and I just recommend that you do the best for you and, do what works. So the other piece, I believe, I really want to convey to you my experience here. The other piece that was, I think, the most, maybe the most scary, is that after being diagnosed with everything in my breast, and remember, we've seen it all, right? Like there's no more to worry about in my breast, and I'm fortunate that I'm stage 1A. For a few weeks, I went through very paranoid state, thinking about what other cancers I may have in my body. So any little lump, my throat, my neck, oh, my stomach is really hurting too much. Maybe I have stomach cancer or, colon cancer. And even, ovarian cancer, and maybe it's late and I don't know because, it's not diagnosed that early. And that stress, that took a little bit of a toll on me, because my breast cancer was diagnosed so early as a surprise without any symptoms. I thought, well, what else may I have without any symptoms in my body? So that was difficult. And then, I also encountered in my personal life a couple of examples of people around me who knew other people around my age who didn't get affected by breast cancer, by ovarian cancer, or in another case, a cancer that spread through, liver and bones and everything. And in both cases, the ladies unfortunately passed away. And that was just too much for me to handle. Just the thought of, what if I was going to die now? What would I do? What would I tell my kids? How would I want my kids to grow up in this world? How much time do I have to say that? How do I need to write to them? I mean, even though I knew I was not going to die from this breast cancer, I really went into that scenario of, oh my gosh, what do I not know? Maybe there's a worse cancer in my body, and I don't deserve to die. And so I want to prepare you as well that this is normal to go through that phase. Okay, so that's when you should call a friend or whoever, or call me. But the oncologist will reassure you, and but I know sometimes you feel like nobody can understand, maybe because many people around you never went through cancer themselves, and you're like, yeah, you don't understand, please, and so feel free, to reach out to other cancer patients. There are support groups and so on, because there is a lot of mental support that's needed. And I think we underestimate that part a lot of times. So do not feel bad if you experience that. That's very, very normal. This is, again, part of kind of the early journey. Now, I'm going to cover a little bit of, what happens after surgery. So usually they will wait for about 4 weeks after your biopsy and everything to schedule surgery anyway. And now let's get ready for surgery. So in my case, because I picked lumpectomy, as I mentioned, it's actually a very quick surgery in a way. You stay there for a few hours. Of course, there is all the pre-op things you got to take care of. The good news is, they have all your images, everything. So it's really about scheduling surgery. In my case, I had to do a COVID test. But other than that, you show up in the morning at the radiologist office. Usually they are localizing your tumor and putting hard wires in your breast to help the surgeon locate the tumor when they are going to remove it. So that seems like, you're being kind of like a rotisserie chicken or something, but they're putting that in your breast, these hard wires, before sending you to the hospital where you're going to have the procedure. And they also, during your pre-op phase, will inject a liquid in your body. It's called nuclear, it's nuclear technology, to help the surgeon seize your lymph nodes. They will typically remove a couple of lymph nodes, even though it looked, in my case, like nothing has spread there, but just to safely check. So the incisions, there would be an incision on top of your areola, as well as the one that's the bigger incision is actually under your arm right there. You can still see mine a little bit. That's where they go through to get the lymph nodes. I think I went in around 8 o'clock in the morning. My surgery was at 12:30 p.m. and I was released around 3:30 or 4 p.m. So it's general anesthesia. They put you down. Next thing you know, you wake up, and they call someone to pick you up. You wear that compression garment, and they prescribe pain medication. My goal was to not take it if I could, and I managed not to take it. For the first 2 nights, I took Tylenol. For the pain, it was an excruciating pain. That's why I didn't take the prescribed pain medication. But I still took some Tylenol to make sure I could sleep okay. Also, I had a nice wedge pillow to elevate and try to sleep on my back because I couldn't sleep on the side. Even with the compression garment, it was uncomfortable. So the first 2 nights, I didn't sleep as well. But after the second night, and that's when also I started removing the garment, at least the opposite, I could sleep on the opposite side. So on the right side, in my case, of the breast. It took a few more days before I could sleep on the left side, which is usually my favorite side. But again, at least I didn't have to sleep on my back for more than 2 nights. I had surgery on a Thursday. Obviously, I was off work that day. I also took the Friday off and the weekend. I actually went back working on Monday. The main reason is because with COVID, I was working from home. So if I had to lay down, on my bed or on my couch, I was very comfortable and I could work. And physically, I was doing fairly well. So the surgery wasn't a big hurdle. The main pain really came from that underarm scarring. And I couldn't leave the arm. Actually, they don't really want you to do a lot of lifting for, I believe, at least a week or 2, nothing very strenuous. So I was actually walking a lot because walking was fine. Obviously not swimming, which I love to do, but none of that, or no biking for at least a week. So my main exercise was walking around, and that was fine. The pain when, kind of gradually disappeared every day, a little bit more, as well as the discomfort. I started being able to be in many different positions. So I would say my surgery experience was really not too bad. I don't want to make it like it's going to be a walk in the park either, because everybody will react differently. But I really feel like, as other women had told me, that, it's not too bad of a surgery to go through. In my case, I waited a little bit before doing radiation because I ended up taking a little bit of a vacation. But I started radiation actually about 2 months after. I think usually they like you to get started about a month after your surgery. I think they want to make sure it's healed to a certain extent. I started my radiation 2 months later, and I will share a picture because it's, I think it was my first day there, and the machine is kind of funny. So of course I have a mask because of COVID, of course. But let me see if I can share this with you. It actually, the machine had a mask as well, so was very, very fun. You can see here the little guy with a mask and me with a mask. So that was really, really fun. For radiation, the doctor had sent me a lot of information ahead of time. And on my first day, the nurse went over the same information, making sure I wasn't worried about it. I knew what to do. It's very localized. So, the whole breast in my case for 4 weeks. So 20 sessions. You go every day, Monday through Friday, usually around the same time, and they, lay you down, blast you, but you don't feel a thing for a few seconds, and you're done. I think most days I was in and out of their building for my treatment in about 10 minutes average, because it was just like, about changing into the gown and laying down on the table, and they know exactly how to position you. And like I said, you don't feel a thing. A few seconds later, it's over. And over time, you get a little bit more red. So also here I'm wearing, you may not see it very well, what they call a radiant wrap, which is a very cool wrap made for women going through radiation. So I did not have to, so I'm not supposed to wear a shirt underneath, but you'll go in with this and it closes in the back, and it's very cool. And it's called radiant wrap, and you can just walk in, lay down on the table, and then open the wrap and close it back. And it's a wonderful program. I will encourage you to check it out. Someone can also give you that wrap as a gift. And it makes you feel a little bit more fashionable, and you don't have to wear the ugly gown every day. So I also use this, and that was really cool. So I bought cream. There are different type of cream. They used to use calendula, which is very commonly used for sunburn, and that's really what radiation, I think, may look like a sunburn. And there are some other creams, one that the doctor recommended called Myaderm, which I ended up buying and using as the first one. There's a version of it with lidocaine that I think if you start blistering, or like if it gets really bad again, which was not my case, may help. So I did not use that tube. I used the regular Myaderm, and then I used the calendula from Warren. I would put it in 3 times or 4 times a day. So early in the morning, because they don't want you to apply more than, shorter than 2 hours before you go and get your radiation. And right after radiation, I'll come home and put it more on my breast, and at least 2 more times during the day and before I went to sleep, for sure. This really helps with the redness. I didn't get red at all for at least a week or 10 times, probably 10 days. Then I started getting a little red, but no pain whatsoever. Very occasionally I may have felt itchy, but that really wasn't bad at all. So I was almost wondering if anything was wrong with their treatment. But I think I just got lucky that I have maybe thick skin that's not sensitive at all. And it was really, in the meantime, at the same time, I was going to the beach a lot and got a sunburn one day on my leg. That was much worse than the whole 4 week of radiation. So I believe it was really not that bad. Actually, I think that maybe the ocean water, the cold water, and, and maybe the seaweed or whatever in it, maybe actually in a way it was good. I mean, I'm not going to claim that, but that really was good. You're not supposed to go in the swimming pool, and my radiation is in the middle of the summer. I am a swimmer. I will admit that I went swimming a few times during my treatment, no more than maybe 20 minutes in the pool at a time, rinsing off and showering right after. That was not a problem for me. Again, most doctors will tell you that they don't want you to go in the pool, but I want to, again, be very candid and upfront with you here. And I did it, and that worked for me. So again, everybody would be different, but I just couldn't help it. And I just knew, I mean, I listened to my body, and I knew I felt okay with it. So no redness, no fatigue. It wasn't too bad. I mean, you may feel tired. I was also not working at the time. I took some leave, and I think that really helped me with my fatigue, because not having the stress from work was definitely very, very, helpful while I was going through treatment. So here is, I'm going to share another picture with you. That was on my last day, I believe, of radiation. I was kind of proud that I was done, and I really thought, oh wow, that's it. And as you can tell, I'm red, but in swimsuit, it really doesn't look too bad. So I hope for you when you go through this that you have a similar experience. Maybe you'll feel a little bit more burn, but with the cream that should really help give some relief, I'm sure. And you know, that 4 weeks should go by fast. And you know, after the 4 weeks, I went back to the oncologist, and they prescribed tamoxifen, which is for me, again, along with the woman issue I shared earlier with cycles and periods, the other piece for me, being someone who's trying to have a natural lifestyle and don't really like taking medication, having to take tamoxifen, which is what they prescribe, especially in younger women, premenopausal women, that idea, it was really hard to convince me to take it, especially for 5 years. But of course, I mean, I have children, I have to stay safe and healthy and live a long life. So I started taking tamoxifen, and I don't experience a lot of side effects. So I know it's okay. And the oncologist really explained to me that this is really to help if any cancerous cells may have gone through the bloodstream or other areas of the body, because those are progesterone receptive, that the tamoxifen will actually play against that and make sure that these cells don't spread to bigger cancers in other organs. So of course, it's a very compelling argument that I don't want to go against. And that is the part that I'm still under after lumpectomy and radiation. So I'm taking tamoxifen every day at 20 milligrams, which is the recommended dose. I take it in the morning. I don't think it makes a big difference. But this is what I got to do at this point in time. Again, I haven't seen a lot of side effects from it. Sometimes I question maybe my body temperature during the night, because hot flashes may be a side effect. It may trigger also some, I think, vaginal dryness, which I haven't experienced, or, you know, so very rare side effects. But again, I think the point here is anything you notice that's out of the ordinary, call your oncologist and just ask, and, you know, and see what's going on. I haven't seen anything very worrisome that will lead me to make a call to the oncologist. So this is, again, where I am at this point, tamoxifen, and, you know, for several years. I hope this wasn't too long. I am so blessed and grateful that I can share my experience with you. And this is really stage 1, early stage breast cancer, experienced by a 41-year-old that I am. And I really hope this information is helpful, because I wanted, again, to share this from the patient standpoint and really make it simple and concise for you to understand what are the things you really need to know, are going to be the choices you will have to make. And some maybe things that they don't tell you right away that I wanted to make sure you know as well, so that you can be prepared. And again, whether you're just watching this to know what happened in early stage breast cancer, and that's great and admirable if you're looking for information, or if you're actually recently diagnosed and going through the same journey as I'm going, rest assured that it's great news, got caught early, that I still am convinced that what we got is something that is easy to remove and cure, not like some other chronic diseases that are, you know, very present in our society, like diabetes, you know, or things that people have to live with for years and years and years. This is something that is going to be taken care of, and we'll get over it and live the rest of our lives like nothing ever happened, except that I think what happened is that we're going to be stronger from it, and we're going to be supportive of other women and help them, and also live our life fully every day as if it was maybe our last day. And having contemplated the fact that we had cancer, I think will give us a different perspective. So thank you again for watching, and I hope that was very helpful. Wish you the best of luck, and thank you again.